The legal debate over releasing detainees from the Cook County Jail continued today as the number of positive COVID-19 cases continues to soar. But does releasing detainees who have been living in this virus cluster put the community at risk? CBS 2 investigator Megan Hickey joins us live outside the Cook County Jail. Megan, you posed that very question to a medical expert.
Right, Erica, there are at least 238 people inside the jail with COVID-19, and medical experts tell me that allowing this cluster to grow is not the right answer, but proper protocols when those detainees are released back into the public are crucial. According to the New York Times analysis of coronavirus data, Cook County is home to the single largest cluster of cases in the U.S., more than doubling the 129 cases at the Life Care Nursing Home in Kirkland, Washington, the country's first major outbreak. Hundreds of detainees have been released due to COVID-19 concerns, and now a class action lawsuit is asking the Cook County Sheriff to release anyone in custody with a heightened risk of contracting COVID-19 due to age or medical history. But the bigger question is what happens if and when they're released into the public? Do they pose a health risk?
I think, I understand people's fear from that standpoint, but I think the ongoing outbreak itself puts the community at risk.
We talked to Dr. Susan Bleasdale, Medical Director for Infection Prevention at UI Health. She says diffusing the infection inside the jail is important.
So you're saying the answer is not to keep everybody who's infected inside the jail?
Trying to separate within a jail setting is very difficult and puts people at risk that are still there, puts the staff at risk, and the potential for increased cases.
And the Cook County Sheriff's Department says if the detainee is COVID-19 positive or symptomatic, they work with state and local institutions to find them an appropriate place to quarantine. In some instances, finding alternative temporary housing. See this setup with temporary tents? It's another off-site quarantine spot with 500 beds. The Sheriff's Office says they're moving detainees from double cells to single cells and consulting with sanitation and infectious disease experts. Now, for detainees who are released but do not test positive, they have their temperatures taken, go through a CDC-approved screening. They do not get a COVID test but are encouraged to quarantine.
Hey, Megan, so who, in the case they do get the COVID-19 test, who is giving it to them and how are they prioritizing those tests?
Right, Erica. So Cermak Health is the health institution that treats these detainees. They are actually currently teaching their staff to administer their own test. That system should be up and running this week, and those medical experts determine who gets the tests.
All right, Megan Hickey live at the jail for us tonight. Thank you.